I have great pleasure in introducing Ananya Somani. Ananya has completed her master's in Nutrition and Dietetics in Australia and is an accredited clinical and sports dietitian. She has gained professional experience in various clinical and hospital settings, as well as in sports such as cricket and swimming. She has worked with Reliance Sports Science and Medicine team and Sohfit, a health and fitness company. Currently, Ananya runs her own practice by the name Ananya Somani Nutrition, where she works with individuals, simplifying nutrition concepts and supporting them to make sustainable behavior and lifestyle changes. May I present Ananya Somani?
Thank you so much. Thank you so much to Rotary Club of Bombay Midtown for giving me this opportunity to speak today. I'm just going to share my screen. So I've prepared a little PowerPoint presentation. And as you can all see, today's topic is optimizing nutrition. So let's get started. What I'm going to cover in today's session is a little bit about nutrients of importance for health. I'm going to touch upon, the risk of malnutrition or not eating enough and how we can prevent that or look out for it, and debunking some myths, especially around protein. So in our little chat earlier, we mentioned some other myths. So I'll try to touch upon those as well as through the presentation. But there's so many myths out there. I'll try to do justice to as many as I can. So let's get started. So when it comes to food and health, what we know is that what we eat can have a huge impact on our health, whether it is impacting, the disease like management or prevention. It can impact our overall immunity, digestive health, mental health, so on and so forth. It's innumerable. But at the same time, there's no magic foods. I can't sit here and tell you, okay, everybody, start eating this because that's going to give you the elixir of, health and nutrition. What we can focus on is the overall diet. And that should be something that is supportive of our health. And that can look individual on everybody because everybody is different. Their health considerations, the background is a little bit different. So through today's talk, what I'd like to focus on some of the commonalities and some of the basics that we can work on to build upon. So when it comes to eating for health, the two major things that I'm going to touch upon today are eating adequately, making sure we're meeting our nutrient needs, and including the important nutrients. So through different stages of our life, certain nutrients become a little bit more important, or we need to be a little bit more conscious of to include because they play more significant roles. So I'm going to touch upon some of those important nutrients we need to pay attention to. When it comes to, eating adequately, malnutrition is something that, a lot of us associate with something that happens, in underdeveloped or developing countries. Even in our country, it's just for people from a low socioeconomic status. And it mostly happens, when you're young and it stunts growth and it has those impacts. But it's also a high risk. It's also something very real that can happen over the age of 60. In fact, there was a recent study which looked at a lot of studies and it summarized the evidence. And in India, in the Indian population across rural and urban settings, so it's not just rural, there is a high risk of malnutrition of about 50% people. So that's 1 in 2 people at risk of malnutrition over the age of 60. So this is something that can happen. And it's a topic that is that I have looked into a lot because my thesis was also based on this. And I also studied malnutrition in the Indian setting. So it's something very real that we need to be aware of. And what we often describe it as is because obviously at that age, it's not about growth, but it's more commonly described as protein energy malnutrition, which is characterized by things such as weight and muscle loss. And we'll now look at, what the risk factors for this are and why it is such a risk. So in terms of, the risks for it itself, why it can develop is because of little things like, appetite reduces, taste changes, maybe due to certain medications or certain health conditions these little things that can happen. Digestive concerns like acidity or gas, not going to the loo, that can make it difficult to eat. Chewing troubles, not being able to swallow food, or even social factors like not having meal times with our loved ones or family members. All these little things can impact somebody's intake. It can reduce the intake and increase that risk of malnutrition, as well as having certain health conditions, because the nutrient needs might change so that one can overcome or manage it at best. And in terms of consequences, this can have a reduced immunity, which is so important today, and all the time, but now it's even more highlighted. Then a loss of muscle strength, bone strength, so it can increase the risk of things like fractures, falls, which are such a risk. Then a lot of us might have noticed that things like bruises don't heal, or little things like that the body is just taking more time to recover. So those are again a consequence. And overall, it has been, there is a lot of evidence for this, that it increases the risk of hospitalization should somebody fall sick, and also it increases the risk of a death related outcome. So it is something that is a very, very serious health risk, and it is something we need to be aware of so that it does not arise. So here are some tips on how we can monitor the nutrition status. So just before I get into this is not a diagnostic criteria. These are just some tips I'm sharing that we can all keep in mind, and keep an eye out for, whether for ourselves or for our loved ones, because it's something that is going to benefit their health. So one of the most easy things to track or to just pay attention to is weight, or muscle loss, more importantly. So looking at things like how do clothes fit, do the shirt start drooping off shoulders, that's very often a sign of muscle loss. Then another little thing to look out for is grip strength. So especially in hospital, we would do this, where we would ask a patient to put their hands like this and test the muscle over here, because grip strength is so important. So looking out for those things. Then around the face as well, looking at these sites, is there significant muscle loss or weight loss which is unintentional? Of course, for some health related reasons, sometimes people might work towards weight loss, but when it is unintentional, that's usually a sign that there is inadequate nutrition coming in. The next thing would be to observe habits. Have there been changes in taste, in appetite? Maybe you're just not hungry for meals, or skipping it, or eating less than you used to. So just being a little bit vigilant about these little things. And the last one is medical testing. So anyways, it's good to have some routine tests done as per, each individual's health history. So adding on to that and checking some nutritional parameters, whether that's, vitamin D, vitamin B12, iron status, just to look out for any nutritional deficiencies so that they can be addressed correctly, rather than taking, supplements or medicines ad hoc, because that's not a safe way to go about it. And what I'd like to really highlight over here is that eventually we all have heard the phrase, prevention is better than cure. So it's about looking out for these, because if anybody has experienced this with a loved one, or anybody in the family or heard of this, it's a very slippery slope. It can change in a matter of weeks or months. I have seen it multiple times, whether it was with patients in hospital or people family members who have suffered in their nutrition status. It happens very quickly and very suddenly. So we need to keep an eye out and prevent it before it becomes something that has more long-term effects. And things that we can keep in mind related to the food, So I think, briefly what we was chatting about earlier, what are the, somebody says eat this, somebody says don't eat this, eat, what time to eat, what food to eat it at night, eat it in the day. So I think at the offset, what I'd like to say is that what a lot of us have maybe heard from the beginning, or remember learning, earlier, like food pyramids, and these are the 5 food groups. The basics still stand true. Those are the 5 food groups. And if we briefly touch upon them, we have grains, things like roti, rice, jawar, nachni, oats. So all different kinds of energy giving foods. Then we've got our fruits and vegetables, all the varieties, seasonal ones, fresh ones, which are a powerhouse when it comes to vitamins, minerals. They provide a lot of fiber as well. Then we've got meat and alternatives. So things like, chicken and fish, dal, sprouts if you're vegetarian, because they're great sources of protein. And we've got then our dairy food group, which provides a lot of protein and other nutrients, but a particular micronutrient is calcium. So things like, of course, milk, curd, paneer. So these are the fundamentals. These are the 5 food groups. And really, I think one of the most common things I see is that people are unnecessarily cutting out one or the other. When there's no reason to, there's no need to. Unless it doesn't suit you, unless you have maybe an allergy, intolerance, or it just doesn't work for you, there is absolutely no need to. Even with health conditions, like if you have heart risk or diabetes, all of these can still be included in one's diet. There's no need to eliminate them. And including them, as you can see, each provides different nutrients. So it's about including them in the right quantity, including them through the day, because you get different nutrients out of it, and it helps to meet the overall requirements. Because while of course we need particular nutrients in the right dose, we also need to make sure we're meeting the overall energy that the body requires to function, because otherwise it's going to not function well for much longer, in terms of there will be deficiencies arising. So we must include these. And a tip that I like to use, rather than saying include 5 serves of this in a day and 3 serves of this, is to try and think about each meal and how it can fulfill these components. Make our main meals, breakfast, lunch, and dinner, nice and complete, which have a source of energy, a source of protein, and something with color, which gives us the fiber and micronutrients. So this can be quite, like, it can look as our everyday meals, quite simple. Like an energy source can be roti or rice. You add on that maybe dal, paneer, chicken, something with protein, and then include some color. So vegetables. So whether that's a sabzi, a soup, a salad, however you enjoy them. At breakfast, it can be, simple Indian breakfasts like an upma or a poha, where you can add some vegetables in there for some color, and then have with that maybe a cup of tea or coffee, or just a glass of milk if you enjoy that. It can be something simple like an egg or a paneer bhurji with some toast. So just looking at those 3 little components, energy, protein, and color, and how we can fit that on our plate when it comes to breakfast, lunch, and dinner, is a great way to make sure that we're getting in enough during the day, and we're eating them in proportions that are quite appropriate. Because if we prioritize that, no, I'll only eat roti and sabzi, then we might be overdoing the roti and not and finding ourselves maybe gaining weight, or in a situation that we don't want to be in. So it's about including them in the right proportion. And in terms of the quantities, that's difficult to suggest in a group setting, but drawing it back to the topic that I was speaking about, it's about watching out for unintentional weight or muscle loss, because that is a typical sign that there is inadequate intake. There is some there is you're not eating enough. That's why the body is having to break down its stores. So definitely watch out for those. If you're at a good and healthy weight, try to make sure that it's stable. And that's a short sign that you are eating enough as per what your body requires. And in case you do notice that there has been, unintentional weight loss, or there have been some changes like that, here are some simple suggestions that, we can keep in mind. So when a common thing to do is then eat small and frequent meals, rather than trying to eat really big meals, which become a little bit too much to have. So including foods which are really nice and nutritious, like having nuts as a snack in between, having a breakfast, lunch, and dinner, but including something in between as well, so that they're coming in through the day. If you're experiencing difficulty in chewing or swallowing or eating certain foods, an easy thing to do is then maybe prioritize nutritious liquids, things like buttermilk, milkshakes, sattu, so that it might be easier to then drink your nutrients, because it's difficult to chew them. If somebody's experiencing a poor appetite, then try to pack in the nutrients rather than having to eat a lot of volume of food, eat this also, that also, 3-4 elements. Maybe make like a mixed meal, like a khichdi, or like a pulao which has vegetables, also chicken or paneer or something, so it becomes something that they can just, it's like you're getting more out of each bite. So trying to make sure that through these little things you can address if there is anything that is difficult or lacking, so that nutrition does not suffer. And I think what I wanted to speak a little bit more in detail about, one of the most common topics that I see is a myth, is whether protein is required or not. Is it good for us? Is it not? So I'd like you all to, think about a few myths that I'm going to share, whether you think it's true or whether you think it's, myth or fact. And I will, of course, address them over the next few slides. So is protein something that only people who go to the gym or who work out require? Does a high protein intake damage the kidneys? And is it adequate, to just eat one meal? Like, okay, I just, in the morning, I have, eggs and for my breakfast, so that's enough. So is that enough? So I'd like you all to think about these. And before I present the answers or clarify that, a little bit more to think about is a couple of situations that I'm going to lay out over here. If any of these sound familiar to you? An increasing difficulty maybe in just regular movements, whether it is standing up from the bed, picking up things from the floor, walking, getting into the car, those little things which require strength or, coordination. Then just unexpected bruises, or they're not healing very well, any issues in that. An increased tendency for, fractures or injuries of that sort, or a requirement to manage certain health conditions, be it, diabetes or a heart risk. Any of these situations, whether one is applicable, more than one, and these are just a few examples, are where nutrition, of course, plays a role, but so does protein. The amount of protein one person is eating can really impact and help to manage them better. And this, I think, is something that I face with a lot of, clients, and as well as whether they're in the, just even in my family or just people that I've worked with. A lot of people start to reduce their intake or reduce their protein intake, thinking that it's not that important, and then they're experiencing these little things, which is actually counterintuitive, because protein and the overall nutrition, of course, can help. But I think it's a big myth that, protein is not required as we grow older. In fact, if we were to present the facts, it's very important for minimizing muscle loss and strength, which tends to occur naturally as we grow older. Over the age of 30-35, it starts to increase. So it's not something that magically happens, when we're suddenly, 60 years or later, where that malnutrition risk might increase. It's something that happens while we're, in our 30s and 40s. So bone health, overall health, it can impact all of these things. Unless one has kidney disease, it's absolutely safe. And I'm not saying, high protein intake of like, what a person who maybe works out multiple times a day or an athlete has. A regular intake as per requirements, because I've noticed this, that a lot of people are not eating enough to meet this. And what this requirement might be I don't mean to get very technical here, but I just thought I'd use an example, is what is suggested is around 1 gram per kilo. So if you're 70 kilos, that would be about 70 grams. And what I tend to see is people are barely eating, 30, 40 grams. There is that typical situation where, it's just coming in 1 or 2 meals, and it's a small, change, but it can really make an impact on all of those things that I've mentioned. And it is one of those nutrients, I think, which has the most myths around it, that no, it's not safe to have and it's not good for you. But in fact, guidelines are constantly being updated, and there is more evidence than ever that as we grow older, it's probably more beneficial to increase the quantity slightly rather than reduce it, because of the role it can have in helping retain muscle, retain bone, because of how that can impact our day-to-day movements, reduce the risk of, falls and injuries, which can have such an impact on our health. So it can actually be really valuable to include. And the easiest way to include it is to spread it out through the day. So these are some examples of, protein rich foods, which I've just divided as per, whether they're based out of plants or animal source, so whether that's dairy or chicken, or meat products. So if we think back to what I suggested earlier, where you have an energy rich food, a protein rich food, and some color on your plate, then through the day, breakfast, lunch, and dinner, suppose at breakfast you have eggs, at lunch there is maybe, chicken or paneer, and at dinner maybe it's, lighter dal and dahi or something of that sort. You're at least getting some sources through the day, and that adds up, and you can then add in some snacks and, other little things come in like nuts and stuff, and get to a good 60, 70 grams. And that can make a huge, huge difference to one's health and management as well of health conditions. Because for instance, if, somebody has diabetes, protein can play a huge role in balancing those blood sugars. So even with managing specific health related conditions, it can be very, very beneficial. And some further tips on, how we can get this in. Like I said, include a portion at each meal. If you're finding it difficult to, eat that, then include it in drinks. Have maybe something like buttermilk or chas, lassi, milkshake, smoothies. So it becomes a little bit more interesting, or you can have it in a way that you enjoy more. Make it easy to have. So if it's difficult to, eat meat, or to have like the chewy foods, maybe mince it and make it into a cutlet, or put paneer in a cutlet, make it into a roll. So something that becomes a little bit easier to eat. And if you have a sweet tooth and you want to include some sweets, so then healthier sweets. So Bengali sweets, what we were speaking about a little bit earlier, like sandesh, can actually be, something that gives a little bit of nutrition. Not to say, I'm not here saying that this is something which everyone must eat, but if you do have a sweet tooth, rather than, having cakes and things, these could be at least a little bit more nutritious. Rasgulla, kheer, having like a nut-based chikki, at least we get something out of it. And another common, complaint I hear is that, no, but it becomes too heavy to digest. I just can't tolerate it. So I think the number one thing over here is that the digestive system does definitely undergo some change, and sometimes foods do become a little bit, more difficult to digest, or some foods might stop suiting us so much. So just include those that are still tolerated, because you want to keep the it's also made up of organs. So you want to use it. Otherwise you lose the ability to digest and to utilize or absorb the nutrients from those two. So for instance, dals like rajma, chola, they're more heavy to have. So if those are becoming, they're leading to too much of, acidity or bloating, then maybe you can stick to lighter ones like moong dal or masoor dal. It's a really good idea to include fermented foods. So dahi, buttermilk, they're nice and light. They're also a way to get in some calcium and protein. So it's a win-win in a lot of ways. So those are some good ones to include through the day. And just those little things can make a difference in keeping the digestive system, keeping it healthy as well. And as we move on, like I said in the beginning, while one of the things that I want to touch upon is eating adequately, preventing malnutrition, what should we eat in just a general healthy diet? The other thing I'd like to touch upon is the other nutrients, other than protein or just eating those 5 food groups. What are the other little nutrients that are important? So I've identified them as 5 particular nutrients that I'd like to highlight. So we'll just go through those.
Yeah.
The first one is calcium, which I think is probably a no-brainer to everyone here, because we know how important it is for bones, and the risk of things like fractures, falls really can increase, and it can be quite have really just poor impact on our quality of life, forget health impacts as well. So including calcium sources like milk, dahi, paneer are great. And if the dairy products work for you, then I do suggest to include a couple of serves of those in a day, 2 to 3 serves. So whether you enjoy it in like a coffee or a tea preparation, having a glass of buttermilk, having some paneer, things like that. While there are, of course, a lot of, and especially now they're spoken about, non-dairy calcium sources, things like sesame or til. It's present in some vegetables as well. Honestly, it's difficult to meet requirements through those. You have to eat quite a large amount. It's just not as potent. And as, as the risk of bone loss increases, the requirements of calcium actually do increase. So I would not suggest to rely entirely on those sources, because it's very unlikely one would be eating enough and getting adequate calcium. So if you're not having dairy because it doesn't suit you or for ethical reasons, make sure that you're having calcium fortified replacement. So something like, nowadays you get things like soy milk, almond milk, and you get them with calcium fortification, or else maybe you're considering a supplement. Of course, when it comes to any supplement, I'd always say to check with your doctor, because you don't want to be playing around with those things. The next I'd like to mention is omega-3s. So these are a type of fatty acid which have a whole host of health benefits. They're really good for fighting inflammation. They're important for heart health. They prevent lots of diseases, in terms of like brain related, like Alzheimer's and, memory conditions. It's also important. It's also beneficial for our digestive system and gut health. So it basically has a whole host of benefits. And I think it's something that, everybody should be including in their diet. And in terms of the food sources, oily fish, so things like salmon, mackerel, they're really good sources. So if you eat fish, if you eat those fish, then include 2 serves of them in a week, and that's a really good way to meet your needs. Otherwise, if you're vegetarian or don't eat fish, then there are all these sorts of nuts, so flax seeds, walnuts, chia seeds, and again, then they're not as concentrated a source, so definitely it becomes more important to eat a good quantity daily. Else, consider a supplement if it's just really difficult to eat those. But with the vegetarian options, you can do little things like, mixing some nuts in a chutney, adding it on to, like a salad or a soup. So those ways might make it a little bit easier. But it's still, I've seen it for a lot of people, it becomes quite cumbersome to have. So then perhaps a supplement might be an option if that's just something that is easier for you to include. The third one I'd like to speak about is vitamin B12. So this is really important for blood and nerve health. And a lot of times, people experience low energy and things like that. And we realized later when we do a blood test that it was vitamin B12 that was quite deficient. So as we grow older, the absorption of this actually reduces. So that's why it becomes a little bit more important to just be aware of and conscious that we're including. And the best sources of these are, the animal-based foods. So whether that is meat or whether that is dairy and related products, those are the only sources of them. So we need to be including those. So invariably those foods also contain protein. So if we include those protein rich foods daily, we can help to meet our needs. The next one I'd like to speak about is iron. So this is super important, for energy levels again, being able to focus on tasks, concentrate, immunity. So a lot of us might have heard of, or might have experienced maybe, having anemia, and there's different types. So we want to make sure that we are including those iron-rich foods, because that is so important for just, the blood, carrying the red blood cells which carry oxygen around the body. So red meat or just even white meat are great sources. Again, there are vegetarian options too, but they're not as concentrated. So then you want to include them on a daily basis, making sure there's something or the other coming in which has iron through the day. So, whether it's dals, having dates, nuts, including including grains like bajra, quinoa, which have a little bit more of iron than the others, can help to just enhance how much you're having, or enhance the absorption as well by doing little things like adding on lemon on your meal, because vitamin C enhances the absorption of iron. The fifth nutrient I like to speak about is vitamin D. So this again has gotten a lot of attention in the past year or so because of its role in immunity. And more than immunity, other than immunity rather, it's also super important for bone health because it helps the absorption of those nutrients of calcium. So it ensures that the bone loss is minimized and keeps the bones, healthy. So the best source, like a lot of us might already know, is the sun. And in India, it is actually around the midday hour that is best, which might not be convenient or possible to get adequate, vitamin D exposure at that time. So if a supplement is required, definitely check your blood levels because you don't want to be overdoing it. Toxicity is very much possible. So this is one of those supplements that I would 100% suggest that you take only as per your blood levels and what is required. And the last thing that I'd like to touch upon is, this is not one nutrient, but it's more a group. So like I said in the beginning, we have those different food groups, and two of them of significance that I've not spoken too much in detail about, but I thought we need to do justice to it, is our fruits and vegetables, because we commonly hear terms like, eat the rainbow and all, and it's absolutely valid. So the different colorful fruits and vegetables all give us different, minerals, vitamins, antioxidants, and these are extremely important for our overall health, our gut health. And gut health is an area which is really, we're just at the tip of the iceberg when we are understanding what all it can impact. But it is tremendous, the impact it can have on our immunity, disease prevention, mental health and well-being. So definitely in the midst of, focusing on, okay, we must include this, and is this good for us? Is that not good for us? I think this is one of those things when it comes to nutrition, which very, very few, myths will come around, or people will say something where, fruits and vegetables are bad for us. It's one of the most unequivocally recognized facts in the world of nutrition, and there are far and few in that. Is that fruits and vegetables are really, really good for us. And the more colors, the more variety we can include, having seasonal fruits and vegetables, including them at different meals, not just having it at one meal, it's going to benefit our health even more. And, so I think that's kind of where I end with a lot of the information that I'd prepared today. What I'd like to just end with is when it comes to, and what we were speaking about before today, before the session started, is that we heard a lot of these myths, right? We heard a lot of things, okay, sugar is not good, or let's say, fruit, don't eat it at this time, and XYZ. There's so much information out there. So I think what is important over here is to kind of strike a balance for yourself, because there is always going to be a different opinion, because nutrition is something that is quite individual. So what tends to happen is somebody tries out something, or somebody implements something in their day, like let's say starting their day with a particular concoction of, let's say, fruits, and then they feel really good on it, and then they maybe advise others. So that's how little information spreads. So what works for somebody else might not necessarily be ideal for you. And when somebody presents facts like fruit is good for you, then that doesn't mean that fruit becomes the only thing we eat, right? If somebody says, amla is a good source of vitamin C, doesn't mean we need to overdo it and, have excess, because more is not better. Excess sugar is not good for health. That's again something which a lot of us are quite aware of. But that doesn't mean that we completely need to deprive ourselves if that's something we enjoy. So it's about kind of striking that balance, filtering out all those messages and things that are there, to kind of take a step back. Is this even relevant to me? Is this something that is applicable, or is this a food that I can enjoy or include? And then seeing how it can fit into your diet. Like I said, the basics really do work. If we can start upon and just think about those 5 food groups, what we enjoy from those, what are the healthiest options there, like, rather than relying on things like maida, having whole wheat and having millets. So if those little things we can focus on and build upon from there, using the template that I suggested, energy, protein, and color at your meals, that's a really good starting point. And then very often the other things are just little factors that we tend to, sometimes get carried away in suggesting, or when we hear about them. So I think, as much as it is good to, know about these things, it's not about falling into the extreme where we become super particular and we just, are really like, okay, everything I eat needs to be absolutely perfect and as per, what XYZ told me, or, what is good for me. Or flip to the other end where it's like, I'll just eat what I want and it doesn't matter. So again, extremes aren't healthy. Find that middle path and, find that balance that works for you. That is what is recommended, and base that balance upon the basics that we know work. And then it's something that can be quite individualized. So with that, I come to an end of my presentation today. So I hope everybody's leaving with some takeaways, like, enjoying that balanced diet where you are eating adequately, including nutritious foods, especially the ones that are more important, and recognize that it is, natural for little changes to occur. Like, for example, digestive changes do occur. So it's making sure that you are having, tweaks to your diet or to your dietary practices to optimize your nutrition, so that you're still getting in enough at every stage of life. And with that, I come to an end. If there's any questions, I'd absolutely love to take them on.
Thank you very much, Ananya. My brush with dietitians and nutritionists has been only after my regular medical every year. And I label them as dietitian stroke nutritionist stroke horrible people. But you are an exception. You are an exception. I don't know how you did this, but you actually told us what we're eating is what we should be eating. And I think you dwelt with it in such a way that it sort of made us feel very, very good that you continue eating what you're eating, and of course balance it out. I think you very succinctly put it as to how you sort of progress it through the day. I'm glad you busted all these particular myths which we sort of have looming all over us. And as you very correctly say, there's only not one glove that fits everybody. So I think, thanks. That was a very, very lovely talk, very meaningful and extremely insightful and useful. If any members have questions, please raise them.
Thank you so much. That's really sweet of you. Thank you. I'm so glad it resonated.
Thank you, Ananya.
Ananya, I want to stop the screen sharing.
Oh, yeah. Sorry.
Thank you, Ananya. This was very, very informative.
Thank you.
But see, I have gone to most of the dietitians and they have all told me to, because I wanted to lose weight, of course, and they've all told me to stop drinking milk and milk products. Whereas your entire presentation, everywhere there is milk and milk products, paneer or something or the other. So how do we lose weight and at the same time get sufficient protein, say 60 grams of protein that we require, our body requires, without having milk and milk products?
So I mean, this is something that I often use with my clients or with people, when I engage in these conversations, is that why? I mean, I'm not the kind to be very prescriptive. So I would encourage you to ask them why they're saying not to have the milk products. Because like I highlighted in the presentation, they're a basic food group. They provide a lot of nutrition. If there's a rational reason that they've recommended you avoid it, then absolutely go for it. If that's something that does not suit you, or ethical reasons, or just any reason that you identify with, then I would say, okay, limit it. But it's not necessary. There are a lot of people who manage their weight, who lose weight eating it. So there is, like I mentioned, different strokes for different folks. It's not necessary. If you're not having dairy products, you can include, things like tofu as an alternative for protein. And eventually, when it comes to weight loss or managing weight, it's a very simplistic, because I'm going to try and keep this succinct. It's the energy balance that matters. So if you're eating more energy than your body is utilizing, you're going to put on weight. If it's equal, you're going to maintain weight. And if it flips the other way, where you're eating less and burning more, you're going to lose weight. So that energy can come from dairy, it can come from sweets, it can even come from roti, rice, and meat products. So it can come from anywhere. So I would encourage you to think about why dairy or why a particular food, when it's about kind of finding that balance within what you're eating, if that makes sense.
Thank you.
Vicky wanted to ask a question. Vicky, please ask.
Yes, hello, hi, how are you?
Hi, I'm good, thank you.
To know that we're getting such valuable advice from you. And may I ask you a situation when a person has a higher cholesterol, and when you go to a nutritionist, they often tell you that do not have egg yellow, and maybe some other things which would add to cholesterol. And but then I visited a pathologist a few days back, and he said there's no relation between food and cholesterol in blood levels. So what is the path one should follow?
So this one is again an emerging area. So for instance, we now know that egg yolks or eating cholesterol does not have a relation with cholesterol, because the production of cholesterol in the body is more intrinsic. The liver produces it, and that's kind of what sets it. So it comes down to the reason. Maybe you have high cholesterol. So there could be two things. There could be genetic reasons, lifestyle reasons. So when it comes to lifestyle and food and habits, definitely there are things that can help to reduce it or manage it. So while it might not be avoiding cholesterol foods, it's avoiding what we commonly call bad fats or saturated fats. So things like butter, fried foods, things which are rich in oil. So you don't want to eat those, because that promotes more cholesterol and more deposition, the atherosclerotic arteries. It increases that. You want to avoid or limit things like, alcohol, smoking, and generally, the healthy lifestyle of, exercising. And other than giving a lot of things to avoid, one of the things which is underspoken about is including a lot of fiber. Because fiber, which you get from fruits, vegetables, it's basically the carrier of things outside of the body. So it helps to take away extra cholesterol and helps to really remove that from the body. So it's not just about what to remove, it's also about what to include, and choosing and finding that balance in both. So I think to summarize my answer, what your pathologist said, it's not that diet can entirely bring it down, but it can have an impact on managing it. And that might make a difference, which is quite significant. So it's not about ignoring it entirely, but if medication or if other interventions are required, they have their place too.
Can I ask a question?
I guess I must add.
Please, Ashwin, please do so.
Thank you.
Ananya, my name is Ashwin Shah.
Hi.
Hi.
Ashwin, I think you have another thing on. So there's an echo.
Oh. Yeah, my wife is in the other room.
No, don't worry. Ask the question.
Yeah, I'm sorry. Yeah, I just wanted to know this reheating of food, does that affect the nutritional value of the food?
So it depends on how food is stored. So there can be very, very minor changes, because there are some things which are water soluble vitamins, and also that might reduce. So that can even reduce with regular cooking. But there might be certain things with regular cooking of food, like having cooked vegetables rather than raw, which increases. So there is a little bit of up and down that happens. But by and large, like reheating food, I would say it's absolutely fine, unless of course that food has been stored outside for too long. So definitely in between, store it in the fridge, because that temperature helps to preserve the nutrients as well. But it's a convenient thing, and we can't, like I say, don't sweat the small stuff. It's very, very minor. If you're eating, it's more important to, eat the nutritious food overall, because you'd likely get enough through that.
Yeah, one more question, Ananya.
Yeah.
Cooking in a pressure cooker,
Mm-hmm.
does that affect the nutritional value of the food?
Again, the different cooking methods, they can impact it because of the temperatures it goes to. So pressure cooker does go to quite a high temperature. So it can reduce certain nutrients. So in that sense, like when it comes to, vegetables and things which are very rich in minerals and vitamins, what currently like evidence says is, steaming or not boiling, steaming it is one of the probably the best ways to preserve maximum nutrition. But that being said, it would be better, like sometimes it's a convenient method. So I would say that whatever helps you get those nutrients in, it can make a difference, but is it significant? That's unknown as of now.
Thank you very much.
No worries.
Okay, can I ask?
Please.
Ananya,
Hi.
I have 3-in-1 questions. One is intermittent fast. We all worried about weight loss. Intermittent fasting has become a norm.
Yeah.
What is your view on that? Second is the timing of the food, which you asked earlier. Should we eat it before meal or after meal? And third thing is about microwave. That sometimes there's a talk about microwave. Don't microwave the food; it kills the nutrients. Can you throw light on all three?
Okay. So I think I'll answer the first in a combined way. So when it comes to intermittent fasting, a lot of people, I think it's become, like you said, quite a trend. And it's like 16 hours, 18 hours, things like that. So eventually, in terms of weight loss, it will only help if you are eating less within that window. It doesn't make sense if you, wait for 12 o'clock and it's like, okay, now I can eat whatever I want. And then and I see people do that. They're literally like, Ananya, it's not 12 o'clock, I can't eat yet. And that's not proper in my books. So what I am more in tune with, or what I have read a lot about and also advice, is something from which the concept of intermittent fasting came about, which is actually called time-restricted eating, which delves from chrononutrition. So eating as per our circadian rhythm. So I think this is very valuable in terms of the timing of food intake as well, wherein it's, around sleep time, when you're preparing the body for rest, rather than getting into snacking and having desserts there, keeping that gap between bedtime and, food, so not eating up 2 to 3 hours before bed. And then in the morning, eating as per your hunger or whenever you feel hungry. So some people are naturally not very hungry in the morning. They're good with just let's say a fruit or a cup of tea or something light like that. And some people do require heavy breakfast. So in terms of timing of food, I think that's individual. But rather than focusing on going by the clock, I would say go by what your body is telling you, eat it as per that, and try to follow the natural circadian rhythm, where, we're eating more during the daytime hours when we're required due to practical reasons like working, or just generally when our day-to-day tasks are mostly occurring during the day, it makes sense to eat at that time and eat less at night when we're preparing the body for rest. And even that system can help you lose weight. Eventually, it depends on what you do eat, because weight doesn't change as much as by the timing you're eating, as much as the quantity and the caloric value of the foods you're eating. So that's the biggest, factor over there. And in terms of microwaving food, so again, this is something that, we do know that it can have certain radiations and that can have effects. So it is still something that, is convenient, is at least helps people eat food. But if you have if you can do without it or limit the use of it, definitely fresh cooked food or freshly heated food is better, because it's not exposed to that. It is a little bit unclear what the long-term impacts, unfortunately, of the microwave this thing is at this point, because it is a newer technology in that sense. It's not been studied over that much time. So as far as possible, what I suggest with my clients and what we follow at home as well is to really limit that use, not rely on it too much when we have the luxury or the convenience of reheating it on the stove top.
May I ask a question?
Of course.
Certainly.
Yeah. So, Ananya, excellent talk. It was very nice and very simple, concise. Yeah. So you said about fruits. So fruits, what happens is a lot of people have misconceptions that it should be had before meals and all that. Another thing is that what about mixing of fruits? As in, having a plate full of different fruits. What would you say about that?
So I think that's something that is more, it's more spoken about in Ayurveda, and that's the Ayurveda science, which I'm not an expert in. So in my, what I advise is that if it suits you, unless you get, because there's a concept of some foods produce heat, some produce are more cooling, so you don't want to mix those. So depending on an individual's, their makeup, what suits them, because especially as adults, we kind of get an idea of, this completely doesn't work for me, or, maybe then, you help them identify those things. If it works for them, if it does not cause any acidity or any discomfort to them, then I'm okay with it. But I would still, be mindful that it should not be like a fruit platter where we're just eating fruit, because again, then you're likely missing out on some other nutrients. So still being mindful more of the portion. So it's easier very often if we stick to one fruit, that we eat a portion which is more required by the body. Like one apple is easier to say than, okay, 3 slices of apple, 3 slices of, XYZ.
Okay, got that.
I'd like to ask a question.
Yeah.
We have a habit of overbrewing our tea to make it kadak, you put in adrak, elaichi, and then you add your milk and whatever, tea leaves, and kind of keep on brewing it for say 5-10 minutes. Is that a healthy way of having tea?
Yeah, that's fine. Because I think when it comes to, I've not actually seen too much of difference in the difference that it makes. But eventually, that's absolutely safe, because that is a, pretty, like the Indian chai anyways is brewed like that. And that, I mean, when it comes to, heating up things and, cooling and treating these ingredients differently, there is a change in some nutrition, but it's always a win and loss. So some things might increase, the absorption of some things might increase while some reduce. So there's no perfect way. So if that's how you enjoy it, it's completely fine to have.
Okay. And green tea, is it a fact that it is good for reducing, and it's a good drink to have, an alternative to tea?
It's good to have, but it's not some magical food that is going to make you burn fat or make you, I don't know, like there's a lot of myths around it. It's not necessary to have. If you prefer regular tea, that's absolutely fine to have as well.
How about coffee? Is it better to have black or with milk?
That depends. So if you don't get milk in through any other way, like a lot of people now don't like the taste of milk, and having it with coffee at least helps them drink a little bit of milk. So I would say then have it with coffee. But otherwise, if you enjoy like, milk in other forms, like you have dahi and all, then you can have it black.
That's
Also
nice.
depends on how much of a coffee aficionado one is, because the purists will say it's only black coffee. So it's also a matter of preference. Yeah.
Thank you.
No worries.
Any other questions?